Hi, I'm Alex Metricarti, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, January 29th. Ed Brubaker, our President and CEO, is not available today, so it is just me providing some updates for you. There's actually a lot going on at Living Branches this past week, so I wanted to make sure I was keeping you up to date. Let me start with our usual roundup of where we are with COVID cases. Right now, we still have one resident at the Willows of Living Branches who is testing positive. That person remains asymptomatic, which is very encouraging. And we have 2 staff persons throughout all of Living Branches who are testing positive. One of those is at the Willows of Living Branches, and the other one is at Satterton Mennonite Homes. So Doc Woods has no one testing positive right now. I feel like I should probably knock on wood as I say that. As a result of the fact that we are seeing a decline in our cases, we are working right now on updating our pandemic guidance. This is the guidance that we had earlier in the fall that said what we were doing for visits and for dining and activities and all of those types of things. So we'll be updating that today and releasing it. Hopefully you'll get it before you see this video even. One of the challenges going forward is that our ability to reopen our campuses is entirely based on how many people we have who are testing positive for COVID. So right now, Doc Woods has no one, and so they are planning that they will be reopening on Monday. Satterton Mennonite Homes still has a few people who we need to finish that 14-day quarantine and testing period. After that is done, they will be looking to open up at various times next week, and the Willows as well. Once everyone's off quarantine and their testing time, they will be looking to open up. So please keep checking your email. We'll be sending updates describing what we are able to do. But essentially, for persons in healthcare, memory care, and personal care, we are looking to get back to the facilitated visits that we were doing in common spaces within the community, what we were doing in the fall before we had to close down when community spread of COVID became so widespread. So that will be wonderful. We know everyone really just wants to visit in your residence room, but unfortunately at this time, we still have no updated guidance from the Pennsylvania Department of Health or the Pennsylvania Department of Human Services that might explain to us when and how we will be able to make that happen. So in light of new guidance, we're going back to our old guidance and at least putting back into place what we had in the fall. For residential living, what our campuses are still not open for visitors for residential living. What we are going to do is tie that reopening to the positivity rate in Montgomery and Bucks counties. Once that positivity rate gets down below 5%, then we will look at reopening our campuses for residential living residents and visitors. Right now, the rate in Montgomery County is about 8%. That's down from 10% and higher just a couple of weeks ago. So the rate is dropping steadily, and we're very pleased with that. But just a reminder, it is elevated. So if you are a residential living resident who's out in the community, whether you're grocery shopping or stopping off to say hello to your family or something along that line, please make sure you're continuing to follow good infection control practices. You're wearing your mask, you're practicing social distancing, and you're using hand sanitizer frequently so that you can make sure that you are not contracting any of the virus. As I said earlier, the challenge with all of this is if we get people who are testing positive again, we are going to need to close down that area of community life until people are no longer testing positive. So we want to make sure we're doing everything we can to keep any infection to a minimum. Speaking of masks and guidance, I had an interesting email from a resident at Doc Woods that I thought I would just share a little bit about. This person was reflecting that there had been some changes in the news recently with regard to recommendations about face masks. We're seeing now that people are saying maybe cloth masks aren't effective, especially towards the new strains of the virus that they're starting to find. There were some recommendations about doubling up masks. And so this person was asking me, hey, what do you all recommend that we do? So I asked this question in our coronavirus response team meeting, and I got a response from both Dr. Hamowitz, who is our medical director, and Mary Sheeran, who's our infection control nurse. And what they both said was that they do not recommend for daily use that people look to buy like a KN95 or any type of N95 surgical mask, or any type of N95 mask. The KN95s, which you can get, they're pretty readily available. They ride up on your face as soon as you start talking, is our experience. And so they allow a lot of air to come in that's not coming in through the mask. So they do not recommend a KN95. What they do recommend is just a plain old surgical mask. But you want to make sure it's the 3-ply surgical mask. Manufacturer doesn't matter so much, but a 3-ply surgical mask is their recommendation if you're concerned about what type of face mask is best. They also are suggesting that you stay away from the bandanas or the gaiters or any of those types of things. You want something that fits fairly close across your face. So hopefully that is helpful. You might notice that I have on a fun little t-shirt, and you'll start seeing more of these t-shirts. This is a t-shirt that we are giving to staff persons once they have their second dose of the COVID-19 vaccine. So we've run 2 second dose clinics now at Doc Woods. So you'll start to see more people who are wearing a t-shirt like this. We're also ordering some fun little ribbons that go on your name badges or on staff name badges when they've had 2 doses of the vaccines. So hopefully that'll be something a little bit fun that we can do while we're still continuing to remind people of the importance of being vaccinated. If you have a moment and you would like to educate yourself, I feel like we've been doing a lot of education regarding the vaccine and how it's effective, if you need to worry, these types of things. We've been doing and trying to provide a lot of education regarding that. We had a wonderful opportunity this past week. Dr. Drew Weissman, he is an infectious disease expert from Penn Medicine, and he was actually instrumental in developing the mRNA technology that is the backbone of like the Pfizer vaccine, which is what we're all receiving. And so we reached out to him. Kathleen Roberts, our director of dementia care strategy, was able to get a hold of his assistant at Penn through some of her contacts. And he was very happy to come and do a webinar for us. So we had the opportunity to open that up to mostly to staff people, to some persons at Penn, some people in the wider community, but to really have a great opportunity to ask him about the vaccines, how they work, why do they feel that they're safe, what do they know about any potential long-term side effects, some really great questions. That seminar is posted on our website on the coronavirus page. So if you'd like to watch that, it's probably about 45 minutes. It's a Zoom meeting, so it's not a very exciting thing to look at, but the information is really, I thought, quite helpful if you're wanting to get more education about the vaccines. And we are having COVID vaccine clinics all over the place right now. In fact, as I speak today, residents in healthcare, memory care, and personal care at Doc Woods have already received or are receiving their second dose. We have a clinic coming up February 4th for healthcare, memory care, and personal care at Satterton, where they'll be receiving their second doses. February 5th, will be a clinic at residential living at Satterton where they can receive their first doses. And February 11th and 12th will be back at Doc Woods for residential living residents, for Doc Manor residents, and then also the 12th at Willows for residents and staff there to get their second doses. So a lot of vaccinating going on in the next few days and weeks, which we are just thrilled to see. As you're all aware, this is something that we are not requiring for residents or staff at Living Branches. So it is your choice whether you wish to be vaccinated or not. But we strongly encourage people to go ahead and take advantage of this opportunity. We're not sure how people are going to get vaccinated if they're not getting vaccinated at our clinics and want to do so later. There have been a lot of rumors, but there aren't a lot of facts about how that's going to happen. So if you're at all thinking about it, I encourage you to take a minute and educate yourself and take advantage of the opportunity to be vaccinated here at one of these clinics. If you have any questions about that, you can feel free to email vaccines@livingbranches.org. I'll be happy to respond to your questions or get the right person to respond depending on what the question is. And of course, in general, if you have questions about our COVID response and what's happening, please feel free to check the website at livingbranches.org/coronavirus, or you can always email coronavirus questions@livingbranches.org, and you can get to us that way. So hope you have a great week. I can't believe that it's just about to be February. Seems like time is flying, but that's wonderful because we're all, I'm sure, looking forward to spring and getting life back to normal. Thank you.